Well, we can now speak to Mohamed Salha, who's the acting director for the Al-Awda Hospital in northern Gaza. He's joining us by phone from there. Mr. Salha, thank you so much for speaking to us on Al Jazeera. What can you tell us about the current situation inside Al-Awda? How many doctors and patients are still present in the facility?
Yes, we are now in the fifth day of the siege of Al-Awda Hospital. Yesterday, Wednesday, the Israeli occupation forces forced evacuation our staff and the patient companies who was with the patients to evacuate the western Gaza city, and now we are 14 of medical staff. We are stay with our patients here in the hospital, and we are not evacuated because I am refused to evacuate the hospital from patients. Even they have to send to us an ambulances because the situation of our patient is the hard situation. They can't walk to go to western Gaza, and we stay with now we have 11 of patients and another two patient company, because there is two girls and our policy is to stay a caregiver with these girls. So now in total we are 27 persons under the siege in the Al-Awda Hospital till now.
Okay, so 27 people still inside the hospital, including patients and staff. As you were talking to us, Mr. Salha, we could hear some loud noise in the background, what sounded like gunshots. Can you tell us if there is still fighting inside or in the vicinity of the hospital?
They are shooting a lot and bombing and surrounding the hospital. They are not now shooting in the hospital. For 2 days they are shooting in the hospital, but now they are shooting and bombing surrounding the hospital. There is a sniper on the buildings, and they are walking in the outdoor area of our hospital. There is a lot of soldiers there. So we are inside the hospital. Yesterday they are entered the hospital and broken the door that closed, or and also anything that is closed is destroyed it, and they have also dogs with them. Check every single centimeter in the hospital. And they left the hospital at 9 from 3 p.m. till 9 p.m. And now we are with our patients. We are in the emergency department in the ground. We evacuate all the patients from the fourth and the third floor to the emergency department in the ground floor, because they are targeting in the second day of the siege. They are targeting the fifth floor with a bomb and destroyed the water tanks, and there's a danger to stay in the third and the fourth floor, so we evacuate our patient down.
Okay, so you're currently on the ground floor level of the hospital with the patients and staff that have remained inside. Can you tell us about the conditions that you're facing right now? Do you have water, for example? How are you able to survive at the moment?
Yeah, we don't have a filtered water before 1 day of the siege till now. Now 6 days without health water. We are now drinking the normal water, and if there is no electricity, we will not have a water, because we have a water from the land directly. So we have a shortage also of fuel, because WHO is the last time that sending fuel. We received from WHO in 22nd of April, and now we are 23rd of May, so more than 1 month we don't receive fuel. And the fuel that WHO is sending to us is only for 2 weeks to running the hospital. But nowadays we are working on the small generator, to operating the small generator only to recharge the battery, and to lighting the hospital, and running some of the small devices that our team has to use.
Sure.
Now, and we are running the small generator only for a few hours because we don't have this fuel. Our central store is far away of the buildings that we are under the siege on it.
Right.
It's 30 meters, and we can't bring any of the medication and medical supplies from central store, and we have a shortage of medication and medical supplies.
Very, very difficult conditions you're facing there as this siege continues. You are not able to leave this hospital, I understand, and some of the doctors are refusing to leave unless they're provided with ambulances and a safe passage. Can you tell us, are you aware of who is coordinating that? Are you talking to anyone about the possibility of leaving the hospital?
Actually, we don't want to leave our hospital. Our patients needed our services. No hospital now in the northern Gaza Strip is work. All of the hospitals is out of service now. So these patients in a hard situation, and they really need a serious services from us. So we don't want to evacuate our hospital. We are providing health services, and we are human. So our humanity will not allow to us to leave our patient in front of us.
But are you not afraid, Mr. Salha, for your safety and for the safety of your patients if you stay there?
What, sorry?
Are you not afraid for your safety and the safety of your patients if you remain inside the hospital? As we could hear when you were talking to us, there's still a lot of fighting going on around you near the hospital. Are you not fearful for the safety of the people who are under your care and your safety?
We told them to bring an ambulance, but there is no ambulance has to come to bring this patient. But really, if we have also the ambulance, where is this patient will go? There is no another hospital to evacuate this patient on to them. So we should to provide the health services in our patient inside our hospital, and to allow to us to bring the medication and medical supplies and to running our hospital.
Right.
So it's not easy to evacuate these patients, and also we are contact. We have a contact with WHO and MSF, our partner, and also UN agencies to evacuate this patient, but we are not succeed, and also to coordinate with the Israeli occupation forces to stop attacking the hospital. We are a non-government organization providing our services to the patients in the northern Gaza, and we have now a huge crisis with the women. They are not having now maternity services. We are the only hospital also providing maternity services in the northern Gaza Strip, and these women will not have these services now. The women will get birth in the shelters and will get in the street at home. No, they didn't have this kind of services in the northern Gaza Strip nowadays. So a lot of problems that people in the northern Gaza will face if the Al-Awda Hospital is out of service.
Yeah, Al-Awda Hospital is located in the Jabalia refugee camp, for our viewers who don't know. And this is a refugee camp which has been repeatedly targeted by Israeli forces since October the 7th. And you've described some very difficult conditions, Mr. Salha, that you've been working under in Al-Awda since the war began. Can you perhaps just give us a final message? What would you like to say today to the people who are listening to you and to the international community?
The message is that we are working with to serve the life of people. We ask everybody to stand with the hospital, our hospital, to not target it from the Israeli occupation forces, and we call on the international community to pressure on the Israeli not to target our hospital, and let us to work and to providing the health services for the people in need.
Thank you so much, Mr. Salha, Mohamed Salha, for speaking to us. We wish for your continued safety and the safety of your patients, of course. Mohamed Salha is the acting director of the Al-Awda Hospital in northern Gaza, which is under siege by Israeli forces. Thank you very much for talking to us.
Thank you.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.